Hello everybody, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist. Should your children get the cervical cancer vaccine? Now, though we call this cervical cancer vaccine, in reality, it is a vaccine against the human papillomavirus. The human papillomavirus is responsible for almost all of the cervical cancers. Apart from cervical cancers, it is even responsible for warts. In males, it is associated with penile cancers and anal cancers. And there is an increasing number of oropharyngeal cancers which are associated with the human papillomavirus. So a vaccine against the human papillomavirus automatically confers protection against all this. Now, there are many different types of human papillomavirus, but the ones which are associated with cancer are two specific subtypes, 16 and 18. So, in about a decade earlier, in 2009-2010, two companies came out with the vaccines against this human papillomavirus, specifically against the subtypes which cause cancer, 16 and 18. Now, what is the safety of this vaccine? Is this vaccine safe? Now we know with a lot of data which is available that apart from mild febrile illness, it does not cause any major side effects. So it is pretty safe to take. How effective is it? Now this has been studied over time. Now we have about 5 to 10 years of data, and the HPV vaccine has been found to be pretty effective against development of cervical cancer and also warts and also even some other types of cancers. Countries which have adopted human papillomavirus in their universal vaccination program have seen a very steady decline of death due to cervical cancer. Who should receive it? Ideally, the vaccine should be given before the first sexual intercourse, so that the immunogenicity which it produces prevents the person from getting the human papilloma virus. So preferably the age should be 2 to 3 years before the age of sexual intercourse. In US, the recommendation is to start giving it to children who are in the age of 11 to 13 years. There are 3 doses which are given at the first dose 1 month later and 6 months later. There is a proposal that younger people who have better immunogenicity, 2 doses are sufficient. Nowadays, there is this one that ladies who are much older can also take the cervical cancer vaccine or the HPV vaccine. Now, there is more data that it is not just females but also males who should be vaccinated. One, because they are also susceptible for development of cancers due to human papillomavirus. They are susceptible to development of warts. And the other thing is that they can act, even though they do not develop symptoms themselves, they may act as carriers and infect other females. So, with the data available, we can safely say that the human papillomavirus vaccine, the HPV vaccine, is highly effective in protecting people against not just cervical cancer, but also many other cancers and warts. So, definitely it is something which you should consider for yourself and your children. Thank you.